everyone, this is Dr. Raymond Gasky from Bradford Family Chiropractic. Today we're going to be going over 5 of the best exercises you can do for TMJ or jaw pain. So I'm going to demonstrate to you right now. The TMJ is going to be right about this angle of the jaw. So clicking, popping, burning in the jaw, difficulty chewing on gum or grinding your teeth sometimes are indicative of TMJ pain. I will advise you, if any of the exercises I demonstrate to you cause sharp pain, go see your orthodontist, your dentist, or if you see a chiropractor that specializes in TMJ, get some advice from them before you continue. So right now we're going to be doing some of the better exercises for those of us that have TMJ pain that can withstand some of the exercises we're talking about. So first thing we want to do before we start is we want to make sure our jaw is set and squared. So how we're going to do this is we're going to attempt to take the tip of our tongue and approximate it to the roof of our mouth, right where the roof of our mouth meets the front of our teeth. So tongue to top of our teeth, and then we're just going to close our jaw. Deep breath, and open and close the jaw about 5 to 6 times while the tongue is to the roof of our jaw. That's going to set our jaw straight. Next thing we want to do is we want to do some basic isometric exercises for the jaw. So the first exercise we're going to do, and again, these are isometric, there's no movement of the jaw involved. We're going to be taking our hand as resistance, and we're going to be pushing our jaw to the side into it, and we're going to be holding this for 6 seconds. Pushing, 2, 3, 4, 5, 6. And we're going to repeat that 6 times on this side, and we're going to do the same thing here, stabilizing the lower portion or the mandible of the jaw, and we're going to be pushing 1, 2, 3, 4, 5, 6. We're going to repeat that 6 times. And yes, I'm very aware on how bad I look doing these or how ridiculous I look. So let's hold the laughter to a minimum. Next exercise we're going to do is another isometric exercise for opening and closing. So what we're going to do is we're going to attempt to open our mouths, except we're going to use our thumbs as a resistance. So we're going to plug the thumbs in right below the jawline, and we're going to attempt to open it for approximately 6 seconds, and we're going to repeat that, yes, you guessed it, 6 times. So to repeat, we're pushing this way against resistance, 6 seconds, 6 times, 6 seconds, 6 times, 6 seconds, 6 times. Another exercise we want to do is to eliminate some of that head forward motion. So what we're going to do here is we're going to do chin retractions. So we're going back, bringing our chin into our neck, holding it for, you guessed it, 6 seconds, and we're going to repeat 6 times. Chin retractions, or jaw retractions they might be called. Next exercise is we want to bring the shoulders back, because when we have an anterior shoulder roll, our head tends to go forward as well. So in this situation, we're going to be retracting our shoulders either this way or hands behind our head, retracting our shoulders, pulling back between the shoulder blades. Again, you guessed it, 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. And we're going to repeat that 6 times. The last exercise we're going to show you right now is going to be more of a stabilizing exercise. It's a little bit of myofascial release work for the back of the neck. So what we're going to do here is we're going to cup our, we're not going to cup our hands together, we're going to take our fingertips and we're going to place them at the back of our head. And as we bring our head down, flexing our chin, we're going to be seeing if we can at the same time release some of the tissues back here. So we're grasping right at the base of our occiput, and as our head goes down, we're seeing if we can loosen up these muscles. So again, this is a 6-second drop. 2, 3, 4, 5, 6. And we're going to repeat this again 6 times. All right, so we've gone over 5 of the best exercises that I know of to relieve long-term TMJ problems. If any of these cause sharp pain or severe discomfort, see an orthodontist, your dentist, or your chiropractor that specializes in TMJ work. Thank you again.